We're going to be talking about immunotherapy versus chemotherapy. So let's get started. So what is cancer? A disease which is abnormal cells divided into uncontrollable and destroys the body tissue. And there's several different types of cancer. There's pancreatic, colon, leukemia, and so many others that we could talk about. As you can see here, this is a little diagram that shows the differences between what a normal cell looks like and what a cancerous cell can look like. It's basically a mutated cell that spreads throughout your body, causing a lot of pain and suffering and so many other symptoms with cancer. And here's another diagram. Today we're specifically going to be talking about colon cancer and how it affected my dad specifically. So what is colon cancer? It's the type of cancer that affects your colon specifically. As you can see here, this is a diagram that illustrates the different stages of colon cancer. It's a growth of cells that forms in the lower end of the digestive tract, also known as your colon. Most of these cancer start off as non-cancerous growths called polyps. Removing the polyps can prevent cancer, so healthcare providers recommend screening for those that are at high risk or over the age of 45. It is also more higher risk if you are diagnosed with Crohn's disease specifically, because it is a disease that is affected your colon, so you're more susceptible to getting cancer. Specifically, my dad, he also had Crohn's disease before he ended up having cancer. They recommend every year with Crohn's disease to check out getting I'm forgetting the word. What is? To have a colonoscopy. Because they want you to every 6 months to have a colonoscopy to make sure that you are preventing yourself from getting cancer. So the differences between immunotherapy and chemotherapy. Immunotherapy is a research focused area that studies the immune system to help fight cancer. Basic scientists and clinical work together to develop new methods to prevent and treat cancer, stimulating the immune response, which boosts the body's natural defense to fight cancer. Typically, this is used in late stage cancers, 3 or 4. Chemotherapy is also a drug that is a very powerful chemical that kills fast growing cells in your body. Chemotherapy is most often used to treat cancer, since cancer cells grow and multiply much more quickly than most cells in the body. This can be used at any stage, whereas immunotherapy is used in specific areas. Chemotherapy can be used at any given point. With my experience with my dad, chemotherapy was kinder on his body. So, cancer is a brutal thing to experience for both the person that has it and the people that are close to them. My dad was diagnosed on November 21st of 2023, which was stage 4 colon cancer. For me, it was one of the hardest things I had to hear. My birthday happened to be the next day. Immunotherapy is brutal on the person receiving the treatment and isn't as effective as some other treatment options, as I mentioned earlier. Immunotherapy, like I said, is used for stage 3 or stage 4 cancers, and it's used to suppress the immune system to fight cancer. Although it's great in theory, it causes fatigue, bad rashes or blisters, can even cause nausea, vomiting, diarrhea, and many other side effects, as stated. Immunotherapy is typically used for stage 3 or stage 4. Clinical staging uses tests to find out how far the cancer has spread and where it is in the body. It incorporates the results of lab tests, imaging tests, physical exams, and biopsies. Knowing the clinical stage can help the doctor plan out for treatment. For example, an early stage cancer might be treated with surgery, while later stage cancer is often treated with chemotherapy. Watson and Przuski from Gale Health and Wellness online collection written in 2023. When my dad underwent treatment, they started him on immunotherapy. At first, he was more himself, more alert. Color even came back to his skin. And most importantly, he was able to eat food and keep it down. Over the next few months, he rapidly got worse, reverting back to how he was in the hospital and worse. He started to lose the ability to walk, lost his weight, lost an appetite, and even couldn't eat anything except for ensures or protein drinks. Over the next few months, his demeanor changed from being himself to being more and more exhausted. That's why I maintain that chemotherapy should be where we